service delays this year have hit record levels, and it's meant many people haven't been able to get the treatment that they need. A GMB Union survey has found over a third of its ambulance workers have had patients die because of long waits.
ITV's Paul Brand has been given exclusive access to the NHS frontline to learn more about the devastating effects delays are having on patients.
In yet another passage, ambulance crews stand waiting with their patients, unable to hand them over until hospital staff are free. This year has seen the highest ever number of 12-hour trolley waits, and winter is yet to come. How long have you been here for, May?
3 days.
3 days? On this bed?
Yeah, on this bed, yeah.
Did you ever imagine that your 92-year-old mum would be on a trolley for 3 days?
No, not in a million years, no.
Well, we're joined now by ITV News UK editor Paul Brand and by Paul Turner, who's a paramedic and GMB Union Deputy Branch Secretary for the North West Ambulance Service. Paul Turner, we'll come to you in a moment. Paul Brand, you've seen a lot in your career. You've done a lot of things, but when you embarked on this particular Tonight programme, were you expecting to find the level of, well, devastation to these individual patients that you found?
No, quite frankly, and I didn't think we would get the level of access that we were given as well, and we do have to pay tribute to the NHS in providing that sort of level of honesty and candour about what's going on inside the service. They did give us unprecedented access to the current crisis. But what we found, essentially, is an ambulance service facing its own emergency. I mean, it really is that simple. And the record delays in the ambulance service are caused by record demand at our hospitals. So people are waiting hours for an ambulance that should arrive within 18 minutes. And that's because when you get to A&E, you can see for yourself in the film, there are queues of patients on trolleys, 19 patients the morning we visited, queued up in corridors, just waiting to get inside the A&E department because there were no beds inside. And the reason that matters is because the paramedics can't leave them until they've been handed over to the hospital staff, so then they can't get back out on the road and get to other calls, which is causing the delays.
So what have we got here? Just talk us through the issues that have meant that this is happening.
I mean, it's complicated, Ben, but that, I think, is the benefit of tonight's documentary, is we literally walk you through, step by step, this backlog through the whole system. And as one person in the film put it to us, what the problem at the front door is all about is a problem at the back door. So the reason you can't get into hospital when you arrive at A&E is because there are no beds available in hospital. And the reason partly there are no beds available in hospital is because there's no social care for people to be discharged. And so we actually were allowed to go onto the wards and meet people who've been waiting 6 weeks, perfectly fit and well to go home, but need a bit of extra help at home with some social care, older people, for example. There's no social care at home, so they can't clear the beds. And that's causing the backlog all the way through the system. So if you're waiting for an ambulance, it's probably because someone else is waiting for social care.
So Rishi Sunak, last one, as Chancellor, put in the national insurance increase in order to tackle the backlog, but also social care as well. And there's all sorts of pressure on the government to reverse that because of the squeeze that everyone's facing on cost of living at the moment. But it feels like something absolutely needs to be targeted on social care. Otherwise, this is just going to get worse.
Yeah, and we actually put our findings to Liz Truss yesterday, who, of course, is the other leadership candidate, and she wants to reverse that rise in national insurance. She's made that a big pitch of her leadership campaign, and she said she sticks to that, despite the footage that we talked about with her, because she feels that if you cut taxes, you're going to boost economic growth. Now, that is a perfectly legitimate debate to be having in the Conservative Party, but it's not a very short-term solution to the crisis. You know, May, who you saw in some of that footage there, who'd been on a trolley for 3 days, is she going to take much comfort from talk of economic growth? It's not going to get her through that A&E department door any quicker in her situation.
Let's talk to Paul Turner, who's our paramedic and GMB Union rep. Good morning to you. Good
morning, thank you for having me.
Yeah, you're welcome. You're not in tonight's documentary, but you've heard, obviously, about this programme. You must be very glad that actually it's being exposed for how actually difficult your day-to-day job is. What was interesting from what Paul was saying, one end of it is social care, but I think we all know this, that actually you can't even get to see your GP face-to-face. So I think there's probably an extra demand. Are you finding that there is just more people wanting you to come to their house, and then that also increases the pressure?
Yeah, what we are seeing is a significant increase in the number of calls that are coming through the 999 system and the 111 system, which then puts that pressure onto the frontline crews, to the EMDs and the call takers. And we just don't have the staff, physically don't have the staff to deal with the demand. So we need to change that. and try and improve the NHS as a whole. The funding in the NHS is not right, in my opinion. You know, we get a lot of money coming forward. So the government gave the NHS 20 million recently. But unfortunately, that money's not recurrent. So what that then does is the employers struggle then to employ individuals, and then we use that on private providers. And we've just seen that in the documentary, where there's private ambulances stood on corridors outside hospitals. You don't know now when you call an ambulance whether a paramedic's arriving or not. Some private providers do have paramedics, but some don't. And even as a county ambulance, not every ambulance has a paramedic on board, which our technicians, certainly within the ambulance service, are trained to extremely high level. So I wouldn't be concerned about that.
Yeah, and Paul...
But I'm glad that someone now has come out and actually saying the truth.
Yeah.
Because this has been hidden for years upon years now, and it's just getting worse. Nothing's getting better at all.
And do you have one of the statistics from the survey that you do for the Tonight programme with the GMB Union reveals that 35% of ambulance workers feel they've been involved in cases where a patient's death was linked to delays. Is there something that pops up in your mind when you hear that stat and you think, yeah, I know that?
Well, it's difficult to answer that question. That survey was based on members' opinions. But what I can say is that any person who waits hours upon hours for an ambulance, there is going to have a significant impact to their recovery, or even at the moment in time. Without all of the research, I wouldn't be able to answer that as a fact. But I do see on a regular basis delays well outside of the 7 minutes for a category 1, 18 minutes for a category 2. And we're now seeing those could be an hour, 2 hours, 3 hours, and so on.
Paul, can I just ask, Paul Turner, can I just ask how you are dealing with this personally? Because my cousin is a paramedic and we're incredibly proud that she does an amazing job, but I know how hard it is on her personally to have to deal with these everyday demands. You know, you want to do your job, you want to pick up these patients, you want to get them somewhere where they can be helped. How are you coping with that, knowing that you and your colleagues are having to make these awful decisions and having to sit and wait when you desperately just need to get these people help?
It's extremely difficult, and what we're now seeing is professionals leaving the trust, leaving the profession and going to find alternative work. Some of that is still within the paramedic remit, but working maybe in private providers or in GP practices. But we're also now seeing people leaving the NHS as a whole and going off to start a new career, maybe driving wagons, buses, anything to get out of the NHS. People join the NHS and we're still there now to save lives the best we possibly can, but we just can't do it. You know, the pressure is absolutely horrendous. We've had no break in it now for years, and people promised us it would get better after COVID. Well, actually, COVID, at the peak of COVID, was probably one of our easiest times because people weren't calling ambulances as they do now. No one wanted to go into hospital, so they stayed away.
All
and
right,
they dealt with them themselves.
Yeah, thanks so much, Paul Turner. Paul Brand, you were listening to that and you wanted to come in.
Yeah, I mean, just to pick up on what Paul literally said just then about people leaving, we met paramedics and also one down from that, which is some of the staff members that Paul was describing there who aren't technically paramedics, but they're often training to be paramedics. And these people in their 20s often who are saying to us they're going to leave. So if you can't even get people at the start of their careers who are enthusiastic about what they're doing to remain in the industry, then that's a real problem. And also just on the other point that Paul made about delays leading to deaths, I think it's very difficult for him to answer that question because no paramedic wants to admit that they're seeing patients who may sadly be dying because of these delays. But I can certainly vouch for the fact that there are dozens of people that we've spoken to as part of this documentary who feel really strongly, and we can never prove it, but that their loved one did die as a result of the delay. And you'll hear so many of their stories in tonight's documentary. It is heartbreaking.
And I know we've got to move on now, but, you know, the call handlers as well, who get all the calls that we just heard from Paul Turner, this huge influx that we're getting now more than ever. They've got to decide where the 4 ambulances that are available out of 19 calls, where does it go? Yeah,
and one of them said to us in the documentary, they feel as though they're playing God with people's lives. It's really, really tough out there.
Well, Paul Brand, thank you for joining us. As ever, it was good to have you. And Paul Turner, thank you for everything that you're doing as well, you and your colleagues. We're sorry that you have to go through what you are at the moment. The Department of Health have given us this response. No, they haven't. It's just gone. There we go. We absolutely recognise the pressures ambulance services are facing. The NHS is providing support to the most challenged hospitals to free up A&E and ambulance crews. We're investing £20 million this year for more ambulances, and the number of ambulance and support staff has risen by almost 40% since April 2010. It's that 20 million we're talking about, isn't it? And retention of that staff is so vital as well.
What time's the programme out?
8:30 p.m. tonight on ITV.
8:30 p.m. tonight on ITV. Thanks so much, Paul.